Okay, I see we are around 21 participants. Do we need to give 1 more minute for more people to join? Gloria? Can you hear me? Just to confirm.
Yes, perfect. We hear perfectly.
Okay, I think we can start and more people can join as we continue. So thank you and good morning, good afternoon to everyone. My name is Faith Nzioka, Nutrition Cluster Coordinator, Rapid Response Team for the GNC. And I would like to welcome everyone to today's English webinar on 2022 Nutrition Humanitarian Needs Overview, that is HNO process. As communicated earlier via email, and as it is the norm, GNC coordination team, we are committed in supporting country-level coordination mechanisms to improve the quality of nutrition programming through the HPC. And today is the beginning of this year's 2022 HPC webinar series. And this webinar today, and also the series as communicated via the invitation, will consist of 3 webinars covering all aspects of the 2022 HNO and HRP process, as well as the 2021 CCPM exercise in 3 languages, that is English, French, and Spanish. So today's webinar will discuss the 2022 HNO process in light of updated guidance by the GNC and OCHA and available support from the GNC. The dates for 2022 HRP process and 2021 CCPM exercise webinars will be communicated in the coming days, with HRP webinar expected in early September and CCPM webinar expected in early October. Next slide. So this webinar has been scheduled for 1.5 hours, that is maximum of 90 minutes. And I am joined by 3 presenters from OCHA and my colleagues from the GNC coordination team, who will take us through the different sessions, as you can see from the slide. As usual, we'll have question and answer session for the presenters to clarify any issues at the end. So kindly feel free to type all questions on the chat box. Also to mention that question and answer for the second session, that is briefing on the 2022 HPC process, will be done immediately after the session because Marcus will be leaving after the session. So kindly, if you have any questions, please be quick to write them on the chat box so you can get answered by the right person. We do not have adequate time for verbal introductions, so I would like to encourage all of us to introduce ourselves via the chat box. So please tell us your names, organization, and which country you are representing today. Next slide. So quickly going through the objectives of today's session. By end of this session, we'll be able to outline key considerations regarding the upcoming 2022 HNO process based on the nutrition humanitarian needs analysis, that is by GNC. We have also guidance from the Global 2022 HPC and the GF guidance as well. So at this point, let me invite Marcus from OCHA to introduce himself and take us through the next session. Welcome, Marcus.
Hello, everyone, and thank you very much for having me. First, do you copy well my audio?
Yes.
Excellent. Before we start, Nordi, I wanted to just suggest maybe it's easier. Let me try if I can request the control of the PowerPoint in Teams. It has become rather easy, so then I can move the slides myself. And if not, no worries.
I don't know if there is this option.
It didn't pop up my request?
No.
On your screen? Okay, we'll leave it at that then. No worries, no worries.
Okay. You just tell me and then I keep moving.
Sure.
Yeah, sure.
So, dear colleagues, I'm Marcus Elton. I work with OCHA here in Geneva in the Assessment, Planning and Monitoring branch, APMB. And specifically, I spend my days thinking and supporting, thinking about and supporting country operations around the humanitarian program cycle. And within my team specifically, I spend a lot of time on needs analysis and humanitarian needs overview. Myself, I cover most of the French speaking operations and the Americas at the moment. So today, what I wanted to suggest in the 20 minutes we have is to quickly go over some fundamentals of the program cycle. I see from the colleagues in the chat that not all of you are necessarily in a HPC country or a country where we have HNOs and HRPs. So I've included in the slides also some basics, not knowing exact the level of familiarity you might have with the HPC. So for those that are maybe more advanced, I hope you can bear with me over the next few minutes. So quickly, I was going over the key deliverables and sort of the key steps of an HPC process. And then briefly, we'll talk a little bit more about intersectoral analysis. I was going to present roughly the structure of an HNO and HRP, so you've got a good idea of what's in there. And then we'll end the presentation talking about linking, needs analysis, and planning. Okay, so next slide, please.
Is that with him or is that with me? So I'm not sure. Anyhow, but I
think we've got someone unmuted. Oh, Nuria, I noticed the slides look very different in maybe when they were integrated into the master. Yes, could you just click through? Voila, oh, they have a different appearance. No worries. Okay, so so for those that aren't entirely familiar, the humanitarian program cycle is this basic idea that needs analysis should help inform planning. You see that on the cycle on the side. And the plan then is followed by a resource mobilization step. And then there's the step of monitoring and implementation and lessons learned. And basically, this is a continuous circle. And all of this is supported by information management and coordination. And in terms of key outputs, what this means is that in a country where we have a formalized program cycle, every year we have a humanitarian needs overview, an HNO, the document right on the left, followed by a humanitarian response plan, an HRP. And those two documents, they feed into the global humanitarian overview that is launched in December of each year. And behind those documents, obviously, there's a whole body of policy and lessons learned and a structure and a process. And the main aim of this, however, is to provide a comprehensive analysis of needs and a forward-looking and prioritized plan to address those needs. And because this tries to pull together all the work of the clusters and the agencies, it has a certain authority that comes with it. And we're going to look now at the HNO and HRP a little bit in more detail, but before doing so, I would like to present to you sort of the main steps, the process behind it. Next step, please. Next slide, please. Voila. Okay, so this looks familiar now. Okay, next slide. Oh, I see what happened. It's because there's a different format of the slides. No worries. So far, it seems to be readable. Okay, so I'm not sure, Nadia, if you can zoom in. I do admit it's a bit small. And for those, if you can't zoom in, colleagues, there is a trick in Teams. Below the three dots, there's a drop-down list. And you have two options there, focus and full screen. For those that want to zoom in a little bit, if you click on those, it does increase a little bit the slide. So try that if you have difficulties reading the slide. And for those that still have difficulties reading, let me quickly explain what you're looking at here. So there's the HPC currently distinguishes between basically 10 steps. And the first step when engaging in an operation where OCHA is coordinating a coordinated needs analysis and a coordinated planning effort is to agree on the scope of the analysis and the costing approach of the plan. This is actually a really important step and obviously it's the precursor to everything else. This is where the discussions with you and other colleagues would happen to set the scope of the needs analysis. This discussion obviously is a bit different in every crisis context. And the idea is here in this first step to develop an analysis plan that will help guide what to focus on, what goes into the analysis, and what doesn't necessarily go into it. And this is important because here is where one determines and agrees on the boundaries of the work. I can remember a concrete example where nutrition discussions with nutrition were ongoing a few years back in Burkina Faso, when the crisis was still at the initial stages, and their discussions was very much to focus the analysis and the planning efforts on the north of the country, where needs were most, where insecurity was most, where the people were on the move. However, I remember there were also in the southern part of the country several areas or pockets, I guess it's not the good term, where nutrition needs were very high. So there was a discussion in this first step, if and how to integrate then those elements into the overall analysis and the plan, although they were outside of sort of the humanitarian context. And these discussions were necessary to get everyone on board and agreed to integrate certain elements and to agree that certain areas would not feature in the analysis because they were back then more in a development context, or the issues were more about structural problems versus acute. So this is a really important step, and because it then helps focus the work later, and it helps also afterwards with the prioritization of the plan. And this first step also is where one then discusses and agrees on the analysis framework, which we'll go into a bit into more detail a little bit later. Voila. And then step 2. The HNO is, or the exercise of doing a needs analysis is based on basically on 2 elements. Is making best use of existing information, of secondary information. So doing a mapping of existing information and analyzing this and using this for the analysis. And by mapping secondary information, we also, sounds a bit conceptual, but this helps you obviously identify the information gaps where we maybe have to do then field surveys, field assessments to fill those gaps. This might be geographic or this might be also thematic. And it's both based on these assessments and existing information that the analysis is then being conducted. And this is here featured in step 2. In step 3 is where then the primary data collection would be then planned. In some operations, there are regular needs assessments going on. In other operations, you might plan and agree on a multi-sectoral assessments that will be jointly conducted. There are organizations such as REACH that provide this service. So there will be discussions around do we need it, and if how do we design this assessment to answer the questions we have. Or obviously in your organizations, you might be planning and conducting these assessments. And then in step 4, this is sort of the heart of sort of the HNO process. This is where we conduct joint intersectoral needs analysis. And we're going to go a bit more in detail into this, what it means when we talk about the intersectoral analysis framework. But this is basically the step where all the partners come together, look at information, make sense of it, start filling out the template of the HNO, focus on specific aspects. This is where you would really look at all the information and think about what does it mean for the most vulnerable groups identified. This is a step where one would facilitate a process to calculate people in need, intersectoral, sort of the intersectoral figure, not the sectoral one. And this is the step where one would try to estimate intersectoral severity, analyze together what are the main drivers of risks, and also formulate a projection of needs that is valid for the planning period, for the planning, for the plan that we are trying to establish in the subsequent step. Voila, next slide, please. And do, if you have a question that comes up, don't hesitate to type it in the message box, and I'll be happy to answer those. So this needs analysis then forms the basis for the coordinated plan. This is not always sequential. Huh? These steps often they are overlapping. Sometimes they even happen in parallel. But the idea is that first you do analysis, and that then helps inform your plan. And as for the HNO, the first step here, step 5, is where the discussions happen, where the scope of the plan is being defined. Now, I'm going to answer. There's a question from Asfia. Outside of humanitarian context, can needs overview be done for the country level? The concept of having a needs overview and the structure applies to, well, it is designed for humanitarian context, but doing a joint analysis of needs can also be done outside of a humanitarian context. In a development context, you would be doing something similar to inform your development plan. There, the focus, the structure, and the method would be slightly different. But obviously, you would want to do, some type of needs overview to inform plans outside maybe an HRP context, but even in development context, you see this happening, although it does look slightly different. So in this step 5, you would define the scope of the HRP. And as I mentioned, this first step, this is also a very important point where partners come together and agree what goes in and what goes out. And there the discussion sometimes can also be rather challenging, particularly in a context that maybe leans more towards development context, but there are humanitarian needs with it. So having a discussion on what to focus on, what goes in, what goes out, what is addressing acute problems versus what might address more structural problems, these discussions need to be have, and clarity should be sought. So there's an agreement on this, right? Because in the end, again, we're trying to arrive at a focused, prioritized plans that really focus on those most vulnerable population, those most urgent needs, versus everything else that might contribute to these acute problems, but maybe there are other tools and processes more adequate to address those development plans or programs and activities that might be more fit to address maybe some of the more structural problems. So this happens in this discussion happens in this step 5. And then step 6, this is a sort of a newer element for those that are familiar with HPC from previous years, is really to make an effort and take time and to conduct a response analysis, meaning having a discussion on in a coordinated fashion collectively to look at appropriateness and relevance and feasibility of different responses and to articulate there intersectoral and multisectoral response approaches based on the needs analysis. So how can we work best together? What's most appropriate to address certain needs or problems in an effective way? And this is then also the point where the discussions happen on developing estimates of how many people are being targeted. In the first step, you estimate how many people in need, and then there's a difference to actually how many people we can serve and target, and that might then be smaller than the people in need because there might be access issues or there might be other partners outside of this exercise, like local communities or national authorities already addressing a certain portion of needs. So there's a discussion of, okay, what are we going to focus on among these people with needs, identified needs? This is where the discussions happen collectively on what we should be targeting on. I just realized I skipped the point in step 5 of when we do the scoping. This is also when we formulate the initial overarching strategic objectives. What are we trying to collectively to achieve? And this is sort of then the frame of the plan. And then, as we go through step 5, we would then refine and detail more these strategic objectives. And below that, often when you look at, if you pick up an HRP, those high-level objectives are very generic. You'll find objective formulated around providing humanitarian assistance or saving lives or protecting people. So rather generic, difficult to measure, not very specific. So what the enhanced HPC process suggests is below that to develop specific intersectoral objectives, where one tries to quantify more and detail more what we're trying to achieve, and provide with those specific objectives, agree on indicators that help us to measure the collective progress towards these objectives. So in this step, this is where one comes together to determine these specific objectives. And at the same time, then obviously within your organizations, you'll be thinking about the cluster response plans and the strategic and specific objectives you might have within your cluster or within your organization, and how they then contribute to these collective strategic and specific objectives. So this is basically where the whole framework the response framework will be put together. All this also accompanied by indicators that help us measure progress against these objectives. Voila. And then in the last step, this is where then the projects are being formulated. These projects also being linked to the objectives. In these projects, it's a step of really quantifying then what these projects are, how much they cost, how much people they attempt to serve, and that's a whole step within the process. Often a step that takes up a considerable portion of the time, and all these projects usually then are being all uploaded into a system. It's called HPC Tools. It's an online system where basically these frameworks are being formalized and made accessible to donors, to the partners, where all this is being captured. What used to be in 100, 200-page documents, PDF files, is now, as we've seen with all the partners, is now all being obviously managed online, so it's more dynamic, more accessible, but it requires obviously people then uploading the projects, etc., endorsing those and finalizing the response plan with that. So these are sort of that is sort of the two key elements. Then there's a third element. Next slide, please. Oh, can you click? I haven't realized they are. Yes, please. That's perfect. And then there's obviously the whole monitoring element to the needs and the plans. In the HNO and in the HRP, there is a requirement to also determine how needs are being monitored and how the response is being monitored in order to allow really for a more dynamic use of these planning tools. And that is also supported by the same HPC Tools suite of solutions that we have. Now, I understand that this was very quick and a broad overview, but if you are keen to learn more about, below you see in green a link, KMP HPC Tools, and I'm happy actually to, let me see how easily I can copy paste this in the chat box, where you can find all the accompanying resources, guidance and templates. Here we go. To help you, which give you all the information basically in more detail of what I just very briefly looked at. And here I'm going to copy for you the actual link to the package. There you will find the whole 2022 facilitation package, all the templates and guidance. So for those that are keen, that's some interesting bedtime reading. You can find it all there. Okay, so this is broadly the process, HNO HRP. Now I'd just like to spend, and I do realize I have to speed up a little bit, just 5 minutes on intersectoral analysis. The next slide, you can jump actually straight to the next one, please, Nuria. Voila. So what do we mean by intersectoral? If you look back a few years, if you will pick up an HNO of 4 years ago, what you would find is thick document, 60, 80, maybe 100 pages of needs analysis. But what happened back in the time is that it was a bit of a bottom-up approach where we would ask the clusters to do their analysis for their sector, share it at OCHA, and then we would try to make sense of that and develop sort of an overall narrative. And the result was very much a multi-sectoral plan where you have each sector doing its own analysis, where there was a bit of an effort to pull it together, but it was actually quite difficult to do because sometimes you would really try to compare, bring together apple and oranges. So the idea was then the discussions were started that we need something to help bring this together more systematically, all the analysis being done. And I would assume actually in the nutrition cluster, you're more used to that because the nutrition is already intersectoral by definition, right? You have health, you have wash in there, etc. So you might be already a bit used to looking at these issues holistically, but as a system, that was not the case. So here the idea is really to provide a single, comprehensive, cross-sectoral and methodologically sound and hopefully impartial overview of an overall assessment of needs. And for this, what was developed, or we are still in development, is the joint intersectoral analysis framework. And this will be the next slide. Can you just click through? Okay, I realize also with it's even now a bit smaller with the different slide format, but here, joint intersectoral analysis framework, and this will be the next slide. Can you just click through? Okay, I realize also with it's even now a bit smaller with the different slide format, but here, if you what we're trying to, so what this joint intersectoral framework is really the idea is to provide an intersectoral analysis of context, shocks, and humanitarian conditions that aims to show the severity and magnitude of needs. Now, we won't be able to go into the detail, but I wanted to take the time just to hear. You see on the right side, you see the graphic illustration of the joint intersectoral analysis framework, the GIAF. And at first glance, it's actually a very simple framework. And you see at the top is the whole context, the analysis of context, and specific topics within that. And the idea is really to understand the context and then to look at the shock or the event that hits that context, and then what the impact is of those shocks on people. If you zoom in a bit, there's 3 elements below impact on systems and services and people and humanitarian impact, and then to analyze that in terms of what humanitarian conditions does that generate for the most vulnerable populations. And they're looking at coping mechanisms, at living standards, and physical and mental well-being. And through that, arrive at an estimate of severity of need. Now, This alone is a webinar of an hour or two, but there are now several trainings, online trainings that you can consult. And I will put it, let me see, also here in the chat. There are some high-level trainings which are really introductions. They're 20 minutes each. That give you more of an in-depth introductions into what the concept is. And then if you are curious, or if yourself are being tasked to work in one of these processes, you might also want to consult these more in-depth trainings, and that should really help you to bring you up to speed. The in-depth trainings include a little bit some simple exercises. They might take half an hour, 40 minutes, depending on the topic. But there you have everything you need if you want to dive in a bit more. Okay, so next slide, please. So as I mentioned, one then tries to make sense of or understand these human conditions and how they generate needs. And sort of a key feature that you'll find also in the training is then having sort of a standardized scale of severity. And it's very small. I apologize again. On the right side, you have this scale where there are sort of predetermined generic descriptions of severity. And that already is actually a big step. We didn't have that in the past. You might have had it in certain clusters. Certainly in nutrition, you have your own measurements, but not all clusters or sectors have this standardized, certainly not at the insectoral level. And this is what that GF now is. So if you're curious, have a look at that. But those are sort of the elements that should help arriving at sort of bit consistent estimates of severity. Voila. Okay, and with this, I do realize that I've been going a bit slower as allocated. Next slide. You can actually skip to slide 12, please, Nadia. Please click through. I really need to get rid of these. Another click. Okay. So here, oh no, one back, please. Basically here, no, one more back. Bit tricky.
Here or
One more, please.
back?
One more forward. I'm sorry. I wasn't aware of these animation points. I'm going to get rid of them all for the other webinars. Voila, that's what we want. So just to make the link. So if you then look at the structure of the humanitarian needs overview on the side, you see that part 1, part 2.3. It very much follows the logic of the joint insectoral analysis. So it starts with an analysis of the context of the crisis, the shocks and the impacts. It has a specific section on the scope of analysis where we clearly explain to the reader what we're focusing, what's in, what's out, what's the method, to really help sort of contextualize the analysis that is being done. And then there's a section on these humanitarian conditions, severity of needs, and an explanation of how the people in need were calculated and what the figures are. It's followed by a section on risk analysis and monitoring, and then after that there's all the sectoral analysis. So that's where you would find your nutrition analysis further down, complemented by a host of annexes, and that is complemented. That very much follows the logic of this GF. And the same, you can click through all the way to the HRP. We can skip this one, just click through, please, till we get to the HRP. Voila. Here, perfect. Here, then is also the structure that and the logic follows the logic of the HNO in terms of here the links are then being made. So you have your in the HRP, you have your overview, you have your strategic priorities. You list your planning assumptions, you make your links back to the needs analysis, and you detail precisely this response analysis where you look at feasibility, appropriateness of this collective response. And then you have all your specific cross-cutting issues also there listed, followed by section on response monitoring, and then you have all the sectoral bits below this sort of chapeau. Voila. So what in this link I shared with you, the 2022 package, you find the templates of HNHRPs, and if you pull that up, you quickly see the structure there on page 3 or 4. That really gives you a quick idea of how what the build-up is of those two documents. Et voila. And with this, I'll finish. The last slide. Please jump ahead. The next slide till we get to slide 21. Voila. So this, oh, just go back one, please. So this is one back. So just to conclude, here's an example from Sudan. How then this all should link. I mean, the whole idea of having these templates, these processes, is to have a needs-based response, right? But what we do see in practice that the two, there's still a tendency to have a de-link. So one focuses on the needs analysis. In parallel, one starts on the planning. Sometimes it has to do simply with timing, that some organizations start their planning processes earlier or later. But there's still this issue of basically doing the plan because one knows already pretty well, you know, what the response should be. One focuses on specific areas. So what we're trying to, at least collectively, at the collective level, to change is really that one does the effort of doing the needs analysis before, and that is being then used for the plan. And I think this is still work in progress. I hear in some organizations they suffer a little bit of the same, that you have a bit in isolation, your needs work being done, and at the same time you have the programming people that need to get the programs going, and that there's often then sort of an element where it's maybe difficult to really link as one should. So I hear that's not just a problem at the collective level or within OCHA, but also in other organizations. But the idea is really to then have this needs analysis inform the planning. And in terms of HNHRP, right now there's very much the link there is between the people in need and the target people, between the objectives, how we formulate the objectives and how they capture the needs identified in the HNO. And then there's this element of severity. So this exercise, this ambition, or this effort to identify and systematize severity of needs in certain areas where we have an aggregation of needs that result in higher severity. Well, this is where the plan should pick up and prioritize on these areas and those vulnerable groups that feature the highest level of severity as a tool to help to prioritize. And this is something that we're trying to improve also over years. And with that, I realize I do need to stop talking. I do encourage to write any questions in the chat, even if I'm going to log out afterwards. I think I still have access to the chat. I'm not sure, maybe because I'm a guest. So I could still see any questions that come up, and if not, I'll just ask Nuria maybe to forward any questions that come up. If you think of something else later, I'm happy to answer that, even if the session is advancing. Over to you.
Thanks very much for this availability of follow-up questions. Because now there is any question in the chat, Faith?
No, I think the question was answered.
Okay.
During the presentation. Unless someone wants to unmute maybe and ask a question, you can raise up your hand. It seems no, because we are behind time. Maybe we can continue, Nuria. Maybe we can check later. Thank you.
Yeah. That's perfect. Thank you very much, Marcus, for this comprehensive presentation and for your availability. So we will continue now. My name is Nuria Salce. I recently joined the GNC as a Nutrition Information System Help Desk. So I'm here today to present, following the Marcus presentation, the part 3, no, the sectoral analysis, which is the guidance that it is recommended to follow for this HNO exercise. Right, so this guidance, the nutritional material needs analysis guidance, it was developed last year, so it was already pilot last year. So I'm sure many of you are already familiar with. So we will give only like an overview of the main steps and considerations, and also I will focus on some updates, on some changes regarding previous. The previous version. So I only would like a question, Faith. Do you see my face? My camera is okay?
Yes.
Okay, sorry, I don't see myself. Okay, great. So let's well, just as a reminder, this guidance was funded by USAID, and a specific task force was created under the Nutritional Information System Working Group of the Global Technical Assistance Mechanism, so oversaw the preparation of this document. And the purpose of this working guidance was to outline the steps for conducting a nutrition situation analysis, identifying information for the HNO, concretely for this sectorial analysis part. This is whether a cluster system has been activated or not. So let's move on the different structure points. Okay, so this guidance has three main steps, but the first one that is developing an annual nutrition plan. We will not focus today. So we will focus more on conducting a nutrition and situation analysis, and the third one to prepare the key figures for the HNO and the subsequent HRP. So the purpose, when it comes to conduct a nutrition analysis situation, the purpose is to define, classify the severity of a given humanitarian situation across affected geographical areas based on the magnitude of the nutritional needs of the population in order to guide strategic and operational decision making. It addresses the questions: how severe, when and where are the worst affected areas, how many, why, who, and what are the key characteristics of the situation. The aim, finally, also is to build consensus on classifying this severity based on magnitude of nutritional needs of vulnerable population groups and their contributing factors. Then when we analyze the situation, we have these three scenarios, scenario 1, 2, 3, that is according to the prevalence of global acute malnutrition. So if we have a prevalence of global acute malnutrition above 5, we will be under scenario 1 or 2. And the scenario 1 is what is more preferably recommended in situations where it is possible to conduct an IPC acute malnutrition analysis. If not, we will go to scenario 2. And for situations where global acute malnutrition is under 5, we will go to scenario 3. Yeah, we move on. I think there was a question, but maybe we leave it at. We will leave the questions from this part and the next section regarding cross-cutting issues and intersectional aspects at the end of the session. So once a scenario has been agreed, there was like a recommended core list of indicators that really they mean to streamline this analysis process, not to override the extensive list of indicators that can be used for programming and monitoring purposes. It's very important that these indicators are aligned with the GIF, intersectional analysis. In fact, they are the same. So, and as you can see here, these different indicators, this is just a piece of how they look like. We only put some of them. And they are by category, and they are also linked to the humanitarian consequence. So for nutrition, we will have physical and mental well-being and living standards. So, and then we will have a severity scale that is based on IPC, acute malnutrition, or OCHA. Some of the thresholds are agreed at global level. Some others are preliminary, based on some studies, but still there is no like a consensus at global level. Okay, so then we are still in the step 2, conducting a nutritional situation analysis. And here we can see the 2 different scenarios where it will be the main indicator to classify the severity. So for under 5 global acute malnutrition, over 5, it will be ideally the IPC acute malnutrition analysis. And if not, we will use global acute malnutrition based on weight height zeta score, because the DARE scores are provided. But if not, still we have the option of under 5 global acute malnutrition based on MUAC, and also, if not available, we still have the option of pregnant lactating woman by MUAC if available. And then we will have all the different indicators looking at qualitative analysis for contributing factors that will help us to classify the severity phase by these colors below. This is for scenario 1 and 2. And then for the scenario 3, the guidance has developed some indicators based on vulnerability of target groups and reliability. And they are like stunting, they are like infant and child feeding practices indicators, and that they will be the ones that will help us to classify the severity. And they are in an Excel sheet that I will comment later. They will help us there are some ponderations, like some scoring system that help us to classify the severity. And one new thing for this year is that, according to experiences in countries, it is possible to add an additional 11 indicator that you consider that is not in these 10 indicators, and you consider for your specific country, it is important to add a new one. And is it you discuss it with the representative and the different persons, so it's an option to include it yourself. And again, we have to include the qualitative analysis. Yes, I see some questions that we will raise. And finally, the last step is to prepare the key nutrition figures for the HNO. So we will need to identify the number of people in need for each specific nutritional, for each geographical area. And what is important is that we really recommend that this aggregation by age, gender, and disability. If the figures are not available, the guidance gives some suggestion on some like a standard percentage that can be applied. Then the PIN calculation for particular population group will be, they are set for a minimum nutrition-specific intervention. So we can see here the type of indicators that we will be calculating in terms of PIN. So acute and chronic undernutrition, overnutrition, infant and child feeding practices, and micronutrient deficiencies. So these calculations will be done automatically in an Excel sheet that we will comment now also. And so this guidance goes with an split calculation tool, and in each of the steps of the guidance, we have a particular type of data that we will have to fill in. Okay, so yeah, this is like a summary of the 3 steps and population and figures. Okay, so with the guidance, there is an addendum that gives some considerations for the GIF, for some contributions to that. So some of the considerations that are given are discussed bilaterally with other sector colleagues in country, their approach, evidence, and key considerations that they will be putting forth for the GIF analysis. No? The idea is to ensure alignment, avoid duplication, and support for the forecasting exercise in terms of the evolution of contributing factors. So another aspect will be important to consolidate the outputs of the nutrition situation analysis led by the Nutrition Information Working Group or equivalent, which includes the raw data, pre-identified nutritional indicator of the affected groups and their associated, always very important, the reliability. Another aspect important for the GIF will be to flag if any nutritional outcome data has a severity level from 3 to 5, as this might be deemed as a critical indicator, potentially equating to imminent death, could be, as these they might be helpful for the critical indicators in the GIF. And finally, this addendum gives some move forward, some steps how to do the aggregation, the nutritional PIN estimations for the GIF. And in fact, one of the updates, one of the new version of the calculation tool to facilitate this calculation already give like a total PIN. So finally, what it takes is that to ensure that there is no overlap by categories, for example. So as a general rule is when the largest single category is used as a proxy. Okay, this is for the addendum. And then this is like a summary of the changes of this guidance version 2 that will be, it is already uploaded in the GNC website. So there are further inclusions of cross-cutting issues, disability and gender-based aspects. So this will be discussed in the next slides a little bit. Also, how to decide between scenarios for countries that over around 5%. So one new thing is that only one scenario is recommended for the entire country. So with these different prevalences, so we will take the one that is the majority of prevalences will be the one that we will consider. Then there is some guidance related to the use of recent data versus outdated data or not available data. That this is, I think, one of the challenges we are more facing nowadays related to COVID last year especially, but also this year. So it gives some guidance. Also, this guidance was also linked to a brief that was published last year. So now it has been introduced in the guidance. So finally, what it says is to do like assumptions when you are mapping all the different available data, more in the contributing factors maybe, or more on routine programmatic data that is available, or surveillance system, the different data available, and looking at comparisons with previous years, looking at trends. And then when this analysis is done, together with different representatives, the different key people doing this analysis, this might help us to do some assumptions if the previous data that we had has improved, has deteriorated, or is stable. So this is, I would say, this is maybe the most challenging one, but there are some guidance to help on that. Okay, and then as I said before, the integration of these 11 optional indicators for the scenario 3 and this new sheet for the total PIN calculation to facilitate some calculations for HRP and GIF. So now in this slide, we would like to give some guidance in relation to the practice of setting pre-established ceilings for the number of people in need at country level. In this sense, the global clusters propose the following steps as a way forward in order to improve the transparency to determine the most in need. So the PIN should reflect the needs based on analysis and evidence without restrictions. If the figures are not representative of the needs, this requires resolution by expert judgment across a diverse group of representatives during the analysis process. At a minimum, any time a cap is set, it should be clearly detailed in the HNO, with rationale for this cap and any steps taken to ensure that the cap was not exceeded. For example, if a list of indicators were removed from the analysis book because of the high PIN figure, so this has to be really explained. So when PIN is preset, the initial calculation PIN also should be identified in the HNO or HRP to ensure a better and more transparent and understanding of the degree why this PIN was limited. So yeah, we wanted to share also this with you. So from here we have finished what we wanted to share with you regarding this guidance and this analysis of the nutritional data. And now we will go to the next session that is regarding cross-cutting issues and intersectional aspects. And this session was planned to be done by Caroline Abla. And but she's in Lebanon and really is facing a challenge regarding electricity and internet. So I don't know now if she's around or not. Faye, do you know if Caroline is there?
She has not yet joined, so
Okay.
you can go ahead.
Perfect. So sorry for that. It was not planned to do myself this one, but I'm going to go through the slides. Okay. So as the first cross-cutting aspects, we had the accountability for affected population assessments and analysis. So the recommended aspects is that we always should have opportunities to engage with affected communities in the assessment and needs analysis process, regardless of the crisis type. This can be done during assessment or during needs analysis stage through consultation with key informants and focus groups discussions. So we will have to consider in the analysis process the diversity of the affected population and specific vulnerabilities, needs, and views of different groups, girls, boys, women, people with disabilities, displaced people, or refugees. Also, we'll have to consider ways to check and validate the results of assessments and needs analysis. Do they match the expressed needs and priorities of different groups of the population? And finally, it's recommended to use joint approaches to need assessments and analysis validation whenever possible to avoid burdens on communities. So this is for AAP. So now regarding gender-based violence, the purpose of the gender-based violence and risk mitigation is to make nutrition services safer and more accessible to women and girls who are likely to be excluded. So these women and girls and their children are vulnerable to malnutrition. Because of COVID-19, for example, women and girls are facing increased risk of GBV and also barriers to access nutritional services. So to identify those risks, nutrition actors need data related to women and girls' safety risk to nutritional services. So some of the information might be available. For example, women and girls risk-related nutrition services, capacity of nutrition frontline workers. But if data is not available, we should consider including a monitoring activity to measure safety perception. At least like 50, the capacity, of nutrition frontline workers could include gender balance for at least like 50%, right? So it could be even 100% for women, whether they have signed and trained a code of conduct, or if they were trained on referrals, for example, GBV referrals. So if nutrition actors couldn't find any records of those, you could consider including response strategy to build capacity of nutrition frontline workers in the response. We go to next slide, sorry. Yeah, and here we can see the framework, the availability, accessibility, acceptability, and quality framework, AAQ. And again, we can see the required information for barrier analysis and the different sources that we could have that. So at the very least, we should consider specific barriers that women including mothers who bring their children and girls to nutritional services. So this framework, AAAQ framework, is a good framework to help nutrition actors to understand various barriers that women and girls face. So, for example, accessibility, look at different barriers, including social barrier. For nutrition, a common barrier is husband approval, for example, to access to nutritional services. So for barrier analysis, we need data related to access to nutritional health services, the quality of nutritional services and availability. And you could add some questions on some surveys in the MSDNA, for example, if possible. If not, we should consider other sources. Okay. And also, we have asked now on a slide regarding the disability inclusion in the HNO. So for one side, we have what do we need to know and where can we get this information? So what do we need to know in our analysis? So how do persons with disability experience humanitarian consequences differently? What are the factors contributing to heightened risk of persons with disabilities? What are the barriers and facilitators to persons with disabilities accessing assistance? And what are the views and perceptions of persons with disabilities? So how can we get information with needs assessment, disaggregated by disability, age and gender, focus group discussion, barriers and facilitators assessments, among others. There is we listen some noise. Maybe you can move, please. Okay. So we also have a slide on cash and voucher assistance. And so what do we need to know in terms of cash and voucher assistance? So we need to know who and where are the most economically vulnerable. What is the market capacity and functionality to provide diverse and nutritious food? What is the needed amount of cash transfer that will cover the cost of an adequate and nutritious diet? What assistance modality, cash, voucher, in kind, do the target group prefer? And what delivery modality works best for the targeted groups, keeping in mind any protection and safety concern related to cash and voucher assistance? So we can get this information regarding community assessments, health program information, market assessment and surveys, and among others. And here we are almost at the end regarding we finalized, we're at the end of the cross-cutting aspects, and now this is just one slide where we wanted to emphasize the intersectional collaboration and programming regarding assessment and analysis. So together with WASH, health and food security, we recommend to plan and conduct joint needs assessment, joint needs analysis, and joint gaps analysis. So with WASH, health and food security, we would like to prioritize interventions areas and affected groups. So we should include critical indicators from the other sectors in your assessment, in the nutritional assessments, if a multisectorial assessment is not possible, for example. And jointly collected information that is disaggregated by different sectoral needs and map out overall and overlap needs. And finally, demonstrate linkages with development players also. So that's it for now. So now it's over to Faith.
Okay, thank you, Nuria, for that. And we'll quickly look at the roles of different stakeholders in the HNO process. This is just a reminder, so I'll go quickly through the presentation. And today we'll be looking at the roles of the cluster partners, the country cluster coordination team, and the GNC coordination team too. So for the cluster partners, they are responsible for collecting and sharing secondary nutrition-related data And I've seen many questions coming in terms of how to make use of this secondary data during this context whereby we have limited primary data. Cluster partners should also review quality of data and carry out joint analysis and interpretation. And this is usually done through the assessment and information management technical working groups. And this is where such technical working groups exist, because in some countries they do not have such. Cluster partners should also ensure affected people's views are collected as part of assessments and ensure cross-cutting issues are included in the analysis. Also, cluster partners should, they are also expected to contribute to the MIRA and HNO processes. And this is whereby the coordination team should ensure there is active involvement of the partners in the entire process as needed. And finally, they should regularly review and update situational and need analysis. So the above points are very clear, and it is the role of coordination team, as I mentioned, to ensure that cluster partners are reminded and are aware of their responsibilities throughout the HPC process. So for the cluster coordination team, or the cluster, that is the cluster coordinator, information manager, and any other person who is involved in the cluster coordination team, you should be able to coordinate and facilitate the role of partners in assessments as shown above. And I think that has been emphasized enough. We should also be able to consolidate assessment data and present analysis through information management tools. And this is very important for standardization and making use of common databases across all partners. The coordination team should share and integrate nutritional assessment results with partners, OCHA and cluster lead agency as well, and contribute nutrition cluster inputs into various needs assessment and analysis platforms available in your country. That one, you can see we have the MIRA, the HNO, etc. Okay, and then facilitate discussions around results and intervention strategies both at cluster level and intersectoral level. Next slide. Okay, we are happy to inform you that, as usual, the GNC coordination team will be providing remote support to countries in both HNO and HRP processes. We have one-on-one calls based on needs and review of draft HNO and HRP documents for all countries. So please remember to share your country documents with us before they are finalized for a quick review and feedback from us. So in this case, you are almost welcome to reach out to the GNC help desk to support for support throughout the process. We have Nuria, you've seen her in the previous presentation, our NIS help desk, who is available for all HNO needs for all countries, that is Francophone, Anglophone, and Hispanophone countries. We have Caroline Abla, our intersectoral help desk, is available for all intersectoral related needs for both HNO and HRP. And I think we've already shared all the contact for everyone, so you're able to write to them directly. We have Brian Stevens, our coordination help desk, who is available for HRP needs for Anglophone countries, and Angeline Grant will be responsible for HRP needs for Francophone countries as usual. And it is important to mention that I am standing in for Brioni until she's back from annual leave, so please don't hesitate to come to me as needed. In addition, the GNC is sharing updated guidance documents on our website. And prior to each webinar, you receive the invitation with some relevant links. So kindly make use of the available resources. I think that is all that I want to share during this session. So we can now move forward to question and answer session. And maybe we can start with the question on how to make use of secondary data. I think you've seen that, Nuria.
Sorry, no, I have not seen the question. So what is the question? Sorry, I cannot see the chat, sorry, because sharing the screen.
Okay, let me quickly get back to the chat box. We have the first question, I think it's both from Abigail and Aspia. Is concerning how to make use of the secondary data whereby we do not have primary data.
Exactly. So in this case, you only have secondary data, right? and the secondary data is recent, so we will have to see mapping all the secondary data if it's recent or not. So this data will help us to look at all the different contributing factors, but especially looking at trends. And we will have always to compare with previous years. Okay, so then regarding if you don't have any primary data, this is a challenge, right? The thing is that any primary data that has been collected at some point, even it's outdated, is the one that the secondary data will help us to make the analysis. So, and secondary data, it can be, it can be, if you have collected, there is a secondary data regarding also the indicators that look at the severity. It's fine, we can do that, yes. So the thing is to map all the different information available, even it's secondary. We look at the core indicators that we really need to analyze for severity and contributing factors. And yes, we can use them, absolutely. Is that okay?
Okay, great for that. And I think we have another question. It's not a question, but a note from Abigail regarding how complicated it is to get disability data from nutrient-specific surveys, whereby we focus on physical disability.
Exactly, exactly. We acknowledge that it's very complicated. That's why the guidance it gives us some estimated prevalence that in the case that finally it's not possible to collect them, we can estimate some figures. But we should at least consider this in the analysis. I mean, exactly, yeah. For the HNO process, we would like this year to emphasize these aspects of cross-cutting, that to include them according to availability and possibility. Yeah.
Okay, great. I think we're still getting some more questions regarding secondary data. And from Aspia, she's talking about the challenges of getting gender or disability disaggregated data from the secondary data. And maybe to pair with what Naima is talking about, considering about secondary data. Maybe considering we use secondary data, modeling and trend analysis in 2020, but with increasing aggravating conditions, including COVID-19 impact, how credible can another year of data analysis, ETC, be valid? It's like we are using secondary data from from one year to another,
Yeah.
Valid. Yeah.
So for the gender-based question, I don't know if Frederick is around, because there was one person that was going to support that on that. Is he around, Frey?
Hi, I'm around.
Thank you.
Sorry, I have to admit I just missed a gender-based question as I was focusing on the secondary data question. Would you mind repeating? Was it for the gender disaggregations for gender and disability?
Yeah, sorry, I was on mute. It's from Aspia. She's saying the challenge for secondary data is we may not get gender or disability disaggregated data.
Yeah. First of all, sorry, my webcam is not working, so you cannot see my face, but happy to be with you all. So I'm Frey. I support GBV risk mitigation into UNICEF-led clusters. So first of all, maybe a little point on secondary data, specifically for a lot of gender, disability, or GBV issues. Of course, there's a lot of secondary data that we would rely on, as not all assessments would maybe have indicators that measure certain aspects of, for example, GBV. As Nuriad mentioned earlier in the presentation, a thing would be, for example, knowing whether women take decisions in the household, because that could influence whether they can access a nutrition facility. And while it doesn't directly measure whether they need nutrition, as in whether they're malnourished or not, so to speak, it would measure, for example, different needs where, you know, they need this access to a facility, but it's not possible. But this data is not necessarily always something you get out of a primary assessment. So it could also be a lot of secondary data review to look for certain aspects that can inform the needs for nutrition. It is true, of course, that with secondary data analysis, we may not get the gender and age disaggregations or the disability disaggregations. I think, of course, it depends on kind of what is available, right? So maybe there is the, for example, MSNA or needs assessment, that was the multisectoral needs assessment, or a displacement tracking matrix like a DTM available from the year prior, where at least you can get some indication as to what are the gender and age disaggregations for the affected population. Of course, these are multisectoral, but still it could be an indication. Now, if this is not available for nutrition, or maybe even overall, right? Maybe multisectorally, the gender and age and disaggregations are not exactly known. I think it's also something that can be discussed within the cluster coordination group or ISAG or whatever you have, or with OCHA, to kind of have an estimate for gender and age disaggregations as well, if there's really no way of getting them from secondary data or from other data sets prior. For example, I know for disability disaggregation data, there's often a kind of rule that for disability, you take 15% of the population as an estimate of people with disabilities. Of course, the better, the closer you are to an actual estimate rather than using the kind of standard is of course better, but there are ways to at least include it, or to have an estimate included in that. And even if you don't have the primary data that really says, okay, you know, people with disabilities face exactly this issue within nutrition or that issue within nutrition, I think, of course, with secondary data, you can at least put this in your narrative. So not necessarily in your severity or your PIN if you don't have these exact figures, but you can at least write in your narrative some issues that may be facing people with disabilities, so that you're still in your analysis are including these populations. And then the second point about secondary data. So yes, it is also true that with secondary data, it might be difficult, particularly if it's a little bit older already. How is it still accurate and relevant? I think I just wanted to say that whilst this is true, particularly when it comes to severity and PIN estimations, there's of course also you and your cluster members who will do the final validation, right? So if pocket X, you know, says like, oh, there's only I don't know, not high SEM rates or something, because that is what your data said last year. But then, you know, because of COVID, because of conflict and what have you, that maybe the situation has worsened. You can, of course, still decide with your cluster members in collaboration and in agreement with everyone that you may change some severity levels, for example, to more accurately reflect the current situation if you don't have the exact data to back it up now. But of course, this all needs to be documented and justified, but it is possible. I hope that answers the question.
Absolutely, Frey, thanks so much.
Okay, I don't think we have any other question. I think the last question was from Nahima, who was talking about the use of secondary data. You know, if you use the same data, secondary data in 2020, and now we are in 2022, okay, and still using the same secondary data, how valid that is.
Yeah, so it's following what Frey also was explaining a little bit. I mean, yeah, the reliability, the credibility will be even more limited this year, right? If it's because it's like one more year. So this has to be really documented. So we really have to document all the different assumptions we have done and all the different data that we have analyzed, even if it's from 2 years ago. And but it's with which this data that we will do our analysis and that we will do our assumptions, and we will discuss with other sectors, and it's with this that we will provide some results, some outcomes. So, but this time it's possible that the reliability, the credibility will be more limited. We have to document it. Thank you.
Okay, there's no any other question unless we have someone. We still have some 10 minutes before our time. So can someone who is willing to ask a question, anything extra you want clarification, you're welcome to do so. You can unmute, maybe raise up your hand. Okay, it seems no. Unless, yes, we have someone. Yes, Frederick.
Hi, sorry, it's me again. I just wanted to also say, sorry, it's not a question, but I did want to also specify that should anyone wish for assistance from us in like helping with analyzing GBV related issues in nutrition, either with your primary data that you have or with your secondary data, doesn't matter, then please feel free to reach out, and we're available to help that analysis so that it can be reflected in the HNO.
Thank you for that. Then how can they reach you, or do you want them to reach you through Caroline, who is our help desk on the cross-cutting issues?
Yeah, it could be either way. I think you can email the help desk, and also I'll put my email in the chat in case you want to reach out, and then I'll also coordinate with the GNC colleagues.
Okay, great. Thank you. Anyone else who wants to add something or ask for clarification? Okay, we seem to be doing well. Everyone is quiet, so all is well. I'm not sure if Nuria, you have any other comments, final comments or anything to mention?
No, it's fine from my side. Thank you very much, everybody, for your participation. We will send a follow-up message from this webinar, and where we will share additional resources for this HNO process. You will receive that, and we are here to support. Thanks a lot.
Thank you, everyone. And as Nuria has mentioned, we are going to share the resources, the presentation, and also the recording via our website. So kindly look out for the resources. So thank you, everyone, and let's keep in touch. And kindly remember to share your HNO documents for review by the GNC. Thank you, and have a good afternoon or good evening, depending on where you're based. Thank you, and bye-bye for now.